Good evening, everyone, and thank you for joining us tonight for the Illinois Bone and Joint Institute's 14th virtual YMCA Education Series program with the North Suburban YMCA. My name is Kim Nyren, and I am the Director of Community Investment at the Y here in Northbrook, Illinois. We are recording this evening's presentation so that you can revisit it again and again. Please feel free to tell your family and friends about it so they too can view on either the IBGI website or the North Suburban YMCA website. When you have questions for the doctor, simply type them into the question section on your screen, and I will receive them, relay them to the doctors at the end of the program. I ask that you please keep your questions general, as they will not be able to address individual concerns without individual consultations. Now, please take it from here.
So welcome to our webinar. We're very excited to share with you information on understanding your metabolic health, how to eat, move, and live better. Dr. Chehab and I will go through a bunch of information today that we hope will be very useful to you. And of course, we're available to answer questions, as Kay mentioned. So we first want to start by defining what is good metabolic health. Well, we like to say that having good energy, sleeping well, having good levels of cholesterol and blood sugar, low levels of inflammation, which we're going to talk a lot about today, and being happy with your weight in a way that is easy for you to maintain. And I think that is the key, is what is easy for you to maintain? What is a lifestyle and nutrition plan that is easy for you to maintain, where you have all these wonderful benefits to your metabolic health? So how do we do this? Well, we're going to talk about better nutrition, better sleep, better movement. We're going to touch a little bit about stress, but really stress is one of those things that probably deserves its own lecture. So we're not going to touch too much on stress, but we're going to try to give you really practical tools today to talk about how you can improve your nutrition, your sleep, and your movement to improve your metabolic health. So we want to start by talking about what is poor metabolic health. Well, poor metabolic health is having chronic inflammation in your body. And chronic inflammation, we're not talking about when you stub your toe and your toe swells up and that's inflammation. We're talking about a chronic low-grade inflammation that exists in our body with inflammatory markers that circulate in our bloodstream and affect every part of our body from our head to our toes. So everything from Alzheimer's and dementia to depression and anxiety, all the way to cardiovascular disease and cancer. These are all affected by chronic inflammation over time. How does chronic inflammation come about? Well, one of the root sources of chronic inflammation is a high insulin level that's circulating in your bloodstream over time. And I always like patients to understand, or my clients to understand, why I'm asking them to do something. So I explain to them that the fat cell has a door that leads into the fat cell and lets food into the fat cell to be stored as energy, and then a door that lets food out of the fat cell to be used as energy by the body, because that is what the fat cell is designed to do. So back hundreds of years ago, when we used to hunt and gather for our food and collect our food over the spring through the fall, and then we would be famished over the winter, because there was no available food. We couldn't forage for anything. The animals were all in hibernation. So we would feast during the summer months, and we would feed off of our own fat cells in the winter months. Well, now we have an abundance of food for the most part, and our fat cell is still designed in that evolutionary way. So food, we eat the food gets stored in the fat cell, and then when we need the food, theoretically, our fat cell will let it out. But what happens over time is the fat cell grows, and as it grows, it actually becomes dysfunctional. And it starts to release a whole bunch of inflammatory markers inflammatory chemicals that get released into the bloodstream, and that is what leads to chronic inflammation in our body. And that inflammation is that root source of disease. So one of the most important ways that we can combat chronic inflammation is to use food. Food is by far the most important medicine we have. And what we eat on a daily basis actually affects the way we fight disease, and it affects our mood, our energy, and our overall sense of well-being. which I'm sure you have all managed to feel that over time. When you eat a healthy meal, you feel good. When you don't eat a healthy meal, you don't always feel so good. So let's talk about what a healthy meal would do to our blood sugar, because blood sugar is what stimulates insulin. So we're making these connections between our blood sugar, insulin, and chronic inflammation in our body. Well, normally what our body likes to have is between 1 and 2 teaspoons of sugar in our bloodstream. So when you get your blood work results and your doctor says your blood sugar level is 92, that is 92 milligrams per deciliter, which is between this 1 to 2 teaspoons of sugar. So somewhere between 60 and 100 milligrams per deciliter. That's the number we want to maintain. That's the number the body wants to maintain, because that's what makes it feel healthy. So what happens when we're out of this, out of that realm of the 1 to 2 teaspoons? Well, we eat something with a lot of sugar. So let's say we eat something with 10 teaspoons of sugar, and Dr. Chehab's going to go through some of that sugar, how to identify sugar in our food. But when we eat a lot of sugar, our body's blood sugar rises, it peaks, insulin comes out of the pancreas, pushes that sugar into the fat cells or into other cells in our body, and oftentimes it overshoots. That insulin kind of goes through a panic mode and pushes too much sugar into the cells, and the blood sugar drops really low. And when that blood sugar drops really low, we don't feel good. We feel tired and sluggish. We have cravings and we have mood swings, and we feel this need. The brain feels the need to eat more sugar, and it pushes you to eat more sugar. And so then you eat more sugar and you do the same thing all over again. And when your blood sugar is high, you actually feel somewhat euphoric. And that's why we often feel good after eating sugar. But this roller coaster is not good for our bodies. So how do we avoid the roller coaster? Well, this is showing you what happens when we eat different kinds of foods. So when we eat carbohydrates that are absorbed very quickly in our body, so carbohydrates that don't contain a lot of fiber, or carbohydrates that are very quickly and easily digested and have a lot of sugar, that blood sugar rises really quickly and then falls really quickly. But when we eat protein or fat, the blood sugar doesn't rise so quickly. And so that helps to control our blood sugar. And when we eat foods that are combined together, when we eat our carbohydrates and our protein together, that will slow down that blood sugar as well. So I always like to start the day with a really important message, which is breakfast is the most important meal of the day. I'm sure everyone has heard that. We've heard it from our grandparents down to our parents and so many generations. But it really is true that breakfast can be any time we break the fast from an overnight fast. So breakfast is the first meal. It could be at 7 in the morning. It could be at 11 in the morning. It could be at 1 in the afternoon, depending on what kind of lifestyle you lead. But that first meal that you have after a long fast is super, super important, because that is what triggers our metabolism for the rest of the day. And what feeds our metabolism the most is going to be an adequate amount of protein at that breakfast or break fast meal. When we trigger the muscle, when we eat enough protein at breakfast, we actually turn on our muscle, which is our metabolism. It's what drives our metabolism. And so we want to turn on that muscle every morning. The easiest way to improve your diet and reduce inflammation, though, is absolutely to decrease added sugars. And so Dr. Chehab is going to talk to you more about that.
Yes. So this is the question I'm always asked. How much sugar is too much? And it's a question that there's no international or national consensus. Every organization from the USDA to the WHO to the Centers for Disease Control have different guidelines. But the guideline that I use, that's the easiest to remember, that's a number that's really, I would say, the median of all the recommendations, is to aim for no more than 24 grams of sugar in 24 hours. And it's really hard because we don't think in grams, but that's what's listed on a food label is grams. So a good guideline is think of no more than 24 grams in 24 hours. And this is a combination of all the sugar that we're going to talk about that hides in some of your favorite foods. This is your, what I call your budget for the day. So just to give us some context, 1 teaspoon of sugar is 4 grams. 6 teaspoons sugar is 24 grams. So if you think in teaspoons, think no more than 6 teaspoons in 24 hours. And in the United States, especially on our food labels, there are many, many different words to describe sugar. And I'm always asked about if one sugar is better than another type of sugar. Here's a list of all the different words, probably not even all the different words that describe sugar. But in your body, they all do the same thing. So a lot of people ask me, well, what about honey? Or what about agave? Or what about high fructose corn syrup? And once you look at the label of that sugar and see how many grams are in a teaspoon of agave or honey, as opposed to just raw sugar or plain sugar, in your body, they all do the same thing. The difference between the sugar is that a lot of times you need different amounts of these types of sugars to get the same sweet sensation. So an example is agave is much, much sweeter than a teaspoon of agave is much, much sweeter than a teaspoon of sugar. But in your body, they do the same thing. So you just might need less of the agave to get that sweet taste. But just remember, sugar is sugar is sugar, and that they all do the same thing to your body. And we do not need sugar. We need protein, we need fat. You become very sick without those items, but you do not need sugar. And in the United States, our largest source of sugar, of added sugars, really comes from what we drink and packaged and snack foods. But if the biggest source of added sugar in this country is drinks, and it's the easiest way to start being mindful of your sugar and limiting your sugar is paying attention to what hides in your favorite drinks. So this is just an example that more than 24 grams of sugar, so remember that's your daily budget, 24 grams in 24 hours, can hide in a single serving of all of these drinks. And there are even drinks that we think are healthy or that are advertised to us as healthy, like a lot of the sweetened teas will say vitamin C or antioxidants. But when you start looking at the label, there's more than your daily budget in a single serving. And we're going to show you how to read a label. So this is a Coke label. This is a 20-ounce bottle of Coke, which if you look at the serving size, it's a single serving. And if you look at the sugars, there are 65 grams of sugar in that single 20-ounce bottle of Coke. So remember, your budget is 24 grams in 24 hours. And I can guarantee, and that's 24 grams in 24 hours of all the sugar that you're eating for the day. And I can guarantee you, most people don't go to the CVS or the Walgreens and buy a 20-ounce bottle of Coke, drink less than a half of it, put it in the refrigerator, take it out the next day, still drink, less than a half and leave a little bit and put it back in the refrigerator and finish the remainder the next day. So it's very tricky because these single serving bottles, can have, like I said, way more than our daily budget. And if you look at the ingredients, it says carbonated water, and then it says high fructose corn syrup. So it doesn't say sugar, it's saying high fructose corn syrup. But fortunately now, by the end of 2021, not only are all commercial foods supposed to have sugars labeled, they're going to have to start distinguishing between added and natural sugars. Because items like milk have lactose, which is a naturally occurring sugar. That's not part of your budget, but added sugars are part of your budget. And then you also have to be really careful about what's hiding in packaged foods. So 74% of all packaged foods have added sugar. And I think kind of the biggest misleader of all the foods are the low-fat foods, because we've been told for decades that these foods are healthy. And what you find in many of these foods is that the original food, such as real Hellmann's mayonnaise, does not have any sugar in it. But low-fat Hellmann's mayonnaise does have sugar in it, because what happens is that when you take when you take naturally occurring fat out of a food in order to make it taste like something other than cardboard, often they add sugar. So it's really, really important not to let the low fat fool you and to really look at labels. And low fat yogurt, again, we're told they're healthy. Inbar and I are both parents, and we see these low fat yogurt products advertised to our children all the time as healthy. You look at the label and they can have a lot of hidden sugar. So it's really important not to be misled by something because it says it's healthy or it's low fat, but to really look at that label. This is, we just put in there to shock you, but commercial drinks also have a lot of sugar. So this is the Shamrock Shake, and it's 93 grams of sugar in a medium Shamrock Shake. And look at how many teaspoons there are. And I always say to people, if you were getting a cup of coffee, there is no way you would put 23 teaspoons of sugar in your coffee and sit there going 1, 2, 3, up to 23. You would think that would be absolutely disgusting. I think even most people rarely put more than 2 or 3 teaspoons of sugar in their coffee. So that's it's just to let you know that there's, I think we all know that there's a sugar in a Shamrock Shake. I think people are always surprised how much sugar are in these items that we consider a treat. But look at that. That's literally over 3 days, almost 4 days, your budget in a single drink.
And I think, Lynn, something we've talked about before is it might be, you know, people might be saying, well, I don't go to McDonald's, but how many of you go to Starbucks and get a vanilla latte or get a mocha frappuccino or something like that? I certainly know that my kids ask for that every now and then. And those contain a ton of sugar as well. So keeping an eye out for that is really important.
Absolutely. So Inbar made the link between how insulin, sugar stimulates insulin and insulin stimulates fat storage. And that you can only imagine then what happens when you have excess sugar and that's stimulating excess fat storage. So again, the easiest way to kind of limit your fat storage, if you're drinking any drink really beyond water, unsweetened tea, coffee, or milk, would be to get rid of it. And so if you drink one regular soda, so a 12-ounce soda every day, how much sugar do you think that's a year? Now remember that 20-ounce soda was 65 grams of sugar. So that 12-ounce soda is about 32 grams of sugar. It's above your daily budget. So what do you think you do to your body if you just cut that 12 ounces of soda out every day? Well, first of all, this is how much sugar that 12 ounces of soda adds up to in a year. Shocking, 30 pounds of sugar a year just from drinking that 12-ounce soda. And then how much weight do you think you would lose if you were to just switch that regular soda and get rid of that extra 32 grams of sugar a day to water or a calorie-free beverage? 15.5 pounds just from cutting out that one soda. So again, this really does a number on your body having excess sugar. And just, I mean, we like I said, Dr. Kirson talked about the relation between sugar and insulin and fat storage, but putting your body in this inflammatory state, in this hyperinsulin state, it's not just about weight. Excess sugars associated, we've always obviously mentioned insulin sensitivity, and it's associated with type 2 diabetes, heart disease, certain cancers, Alzheimer's disease. A lot of neurologists are calling type 3 diabetes because there's such a link between excess sugar. It can damage your hypothalamus, which is the relay place in your brain that lets you know when you're hungry, when you're full, and what to do, whether you are going to store excess calories or burn excess calories. We talked about how it leads to weight gain, and I'm a pediatrician, so I have to mention that obviously it leads to cavities. So one question that Dr. Kirson and I get all the time is, well, what about fake sugar like Splenda or stevia? Like, you know, what's wrong with that? There's no calories. What do you think about that? And we both have the same conclusion that even though you might not get the calories from a fake sugar, it's still doing something to your body because it is telling your brain that you are consuming something sweet. And so they might not trigger insulin, but it still triggers the same cascade that you get when you have something sweet, where we are biologically programmed to want more and more of a sweet substance. Because as Inbar mentioned, back when we were hunter-gatherers, what sugar existed in our world? It would be fruit, honey. Those were very seasonal. So you were biologically programmed to want to eat as many strawberries as you can, because back in the day, they wouldn't be there the next week. So sugar does something, it triggers your brain to think that you're having something sweet. There have been multiple studies that look at your microbiome, and there's a lot more research coming out with the involvement of the bacteria in your gut and your immune system and weight gain and a lot of other health factors. And artificial sugar can change the composition of what bacteria lives in your body. And again, it's not good. None of these artificial sweeteners are healthy. None of them have any nutrients or redeeming values. And I always say to people, I kind of think about it, and maybe it's a little dramatic, like heroin and methadone. So if you are a heroin addict and you need to get off your heroin and you need that methadone to get off the heroin, that's awesome. But you don't want that to be on a drug to be your long-term plan. And that's how I think about sugar and artificial sweeteners. There are a lot of people who have a real sugar addiction, because we talked about it. We are biologically programmed to want it. But if you need to go from Coke to Diet Coke to get off the Coke, if that's the only thing that's going to get you off the Coke, that's great. But it's not a good long-term plan, because in the end, it's still not good for your body.
So we're going to dive in and talk about better sleep. But Lynn, I wanted to mention something just off that, something that came to mind when you were talking. And that is that, and you spoke so well about how we're so addicted to sugar when we eat sugar. But the same thing happens in the reverse, is when you stop eating sugar and you take 3 or 4 days and really cut down the sugar, you actually stop those cravings for the most part. I'd say there's a handful of % of people that really struggle to come off sugar, but really for the most part, in my experience, and maybe Lynn, and your experience too, it's like once you cut it out, it's a lot easier to stay away from it.
Right. And I was about to say, one thing I love about what you and I do, Inbar, is that so I'm a pediatrician, I work a lot with teenagers, I get them to get rid of their sugary drink, and then they'll tell me months later, oh, Dr. Chehab, I was at a restaurant and I had a sip of Coke and it was disgusting. I mean, you really reset your taste buds really quickly coming off of it.
Yep. So let's talk about sleep. Why is sleep so important? Well, one of the things we're gonna mention down the road, and I think in retrospect, I should have had these slides a little reversed, but one of the things that we do on a daily basis that is the most stressful is wake up in the morning. And stress is, well, let me back up. Let's talk about sleep first. Sorry, I'm getting ahead of myself. So let's talk about sleep. Why is sleep so important? Well, we know through studies that chronic sleep deprivation will actually lead to pretty significant inflammation in our body. When we're sleep deprived, we also have increased hunger. We have increased opportunity to eat because we're awake for more hours. We have more stress because our cortisol hormone, which is our fight or flight hormone, is elevated longer in our body. And we have, of course, fatigue, right? When we're sleep deprived, we're fatigued. And all of those things cause this crazy roller coaster in our body, and it comes back to that sugar roller coaster. It has the same impact as that sugar roller coaster. So how much sleep do we actually need? Well, adults need more than 7 hours. Teenagers need 8 to 10 hours. What do we actually get in this country? Adults, about a third of adults get less than 7 hours of sleep. And as we age, that becomes even less. And teenagers, a third of them get less than 8 hours of sleep. So some teenagers, although they shift their hours, they might go to sleep at 11, 12, 1, 2 in the morning, they often will sleep until noon, 1 o'clock in the afternoon. So they shift their circadian rhythm, they're still getting adequate sleep. But if they're not getting adequate sleep, then that really does impact them over time. So we want to give you guys some real good techniques to improve your sleep, because it really is important, and sleep is so connected to chronic inflammation. But some of the things that you can do is a relaxation exercise where you actually tense every part of your body, starting from your head down to your toes, or in reverse from your toes up to your head. If you haven't fallen asleep within 15 minutes, you should probably get out of bed, go do something else, and then when you're sleepy, get back into bed. Because bed should be really reserved for sleeping, and your body should know that when you get in bed, you're ready to go to sleep. Being mindful and acknowledging that you have trouble sleeping, acknowledging the thoughts that you're having and not dwelling on them. So one of the things that I have patients do is I have them keep a piece of paper next to their bedside, and I have them jot down anything that they're thinking about. And so that it's kind of like a mind dump, right? You just dump out everything that your brain is thinking about, and you don't have to think about it for the rest of the night. Your body can relax, your brain can relax, and you can go to sleep. There's lots of apps that you can use that help with imagery and with calming and meditation. Sometimes those work for people, some people don't like those. And of course, one of the most important things is avoiding alcohol, especially before bed. So I know that during COVID, a lot of my patients and a lot of my friends have turned to having a glass of wine every night or having a cocktail with their family, because what else is there to do when you're stuck indoors, right? And so that alcohol is actually significantly interfering with your sleep. And so avoiding that alcohol can really improve your sleep.
And
other strategies, yeah, go ahead.
Oh, you're gonna mention it, but I was about to say for children, the biggest thing is screens. So it's not, that's the biggest thing that keeps kids up at night, and it's really getting them out of their room. And you got to remember, we have a whole generation that has been programmed from a very early age to be very alert when their phone lights up or they hear a ding. And I think it's almost impossible to get a good night's sleep if you have your phone next to you.
Yeah, I think that's true for adults too. I don't think it's just for kids. I think when the phone is in the room and that blue light goes on, kind of alerting you that something went on, and even when you have it on do not disturb, the screen still turns bright. And so it is disruptive. So I agree, screens absolutely. For 1 hour before bedtime, that is the recommendation to improve sleep. Not eating for 3 hours before bedtime actually allows those insulin levels to drop and allows your stress hormone to drop so that you can have better sleep. Dimming the lighting, so starting at about 5 or 6 in the evening, if you start turning off the lights in rooms that you're not using and dimming the lighting in your room, you're kind of mimicking the sun setting, and your body actually takes its signal from the sun setting. Keeping the room temperature, the ideal temperature is less than 65 degrees. We know that our bodies actually need to cool in order to fall asleep. So you want to have your ambient temperature be 65 degrees or less. And then setting a bedtime ritual, letting your body know that sleep is coming. That's what's going to help you over time improve the quality of your sleep. And so I was starting to talk about stress, but it was out of order, so I apologize for that. But stress is dessert spelled backwards. So if you think of it that way, that can remind you that when you have a chronic level of stress over time, it's like the same as having a high sugar level in your bloodstream. It does the exact same thing to your body. And we've already talked about how that high sugar can lead to chronic inflammation, which can lead to disease. And so stress does the exact same thing. Take it away, Lynn.
I'm going to talk to you a little bit about better movement, because I think a lot of us have this idea that if you don't get up at 5 in the morning on the treadmill or out for a run or a bike ride, it doesn't count. And so we're going to talk about ways to increase your movement and to activate the largest organ system in your body, your muscles, in ways that should not be so hard and enjoyable. So both Dr. Kirsten and I love this quote: "Sitting is more dangerous than smoking, kills more people than HIV, and is more treacherous than parachuting. We are sitting ourselves to death." And this is by the doctor who invented the standing desk. So we really embrace this. And so remember, exercise is supposed to stimulate, not annihilate. Again, we have this very American idea that we got to get up and exhaust ourselves first thing in the morning. And remember, the world wasn't formed in a day, and neither were we. So the whole point is you're going to set really small goals that you can do and build upon them. And another quote we really love is we do not stop exercising because we grow old. we grow old because we stop exercising. So one thing that Dr. Kirson and I talk about is this idea of NEAT, which is, have you put up the slide, the non-exercise activity thermogenesis. So it's movement that we don't traditionally think of as exercise, which is all the small movements that we do during the day add up. So ways to increase what we would call kind of non-planned exercise or non-traditional exercise, or ways to get yourself moving, is really adding movement, small movement, any place you can during your day in a way that would eventually become a habit. So instead of sitting on the phone, get up and talk and pace while you're on the phone. Take the stairs instead of the elevator. Use a bathroom on another floor. Park at the back of the parking lot instead of as close as you can to the door. Carry your groceries, carry your laundry, dance to your favorite songs. These are all ways, small ways that increase your movement that over the course of a day really add up, and that they engage your muscles and keep you moving. So again, a lot of people feel like, well, if I can't get up and, go for a jog for an hour every morning, then I can't exercise. And what we're saying is there are lots of different ways to exercise, and they don't have to be in these huge increments. But if you can add them into your day in small increments, at the end of the day, it can have the same net effect on your body.
So Lynn, I was just going to add something that I recommend to patients a lot, especially during COVID, since we've been working from home, and oftentimes that reduces our non-exercise activity thermogenesis because we're not commuting to work, we're not walking to the train, we also have limited the number of times we go to grocery stores and things like that during COVID. And so something that you can do at home is you can still go to the bathroom on another floor, even if you're at home. You can also take 1 minute every hour and go walk up and down the stairs in your house, or you can take 1 minute every hour and do something like push-ups or sit-ups or desk push-ups or wall push-ups or something like that, or squats. And 1 minute every hour adds up throughout the day, but it doesn't take a huge toll on your day. And so it's a great way to incorporate some strength training and some more activity while you're stuck at home working from home.
Right. And that's what I like for teenage patients who have their headphones on all the time, anyhow, listening to music. I'll say, just rock out every once in a while to your favorite song, and do it in a way that you would never do it at school because you are stuck at home. But that, again, that all counts. So we talk about, like I said, the whole point of this non-planned exercise is to engage the largest organ system in your body, which is your muscles. And we talk about muscles. So we talk about fat being a very active tissue that secretes all sorts of inflammation. Muscle appears to do the opposite of that and tends to bring down our inflammation, and is released. The more we learn about muscles, are all the good chemicals that releases in your body. And just think about it. When you exercise, you can be very tired and sluggish. You go out for a walk and all of a sudden you feel energized because your muscles are releasing these really good chemicals. When you diet, or when you lose weight, or when you age, a couple things happen. You can lose muscle mass. Your muscles can become less efficient. And we both recommend that as you tend to lose muscle mass starting around age 30, young ages, that one thing to add into your routine in addition to this non-planned exercise is what we would call resistance training, which is using muscles and using weights or your body weight to stretch muscles. So an example would be working with rubber bands or just having small arm weights. But those are a different way to engage your muscles that really kind of puts your body into what we would call a fat burning mode. I know, Inbar, do you want to add to that since you work more with adults?
Yeah, so it is something that we see often as the atrophy of muscles. And so strength training is really important. And I think the tool that I give people is to try to incorporate 10 minutes a day of pure strength training. And again, that can be done as 1 minute an hour, or it can be done as 10 minutes altogether. But it can be everything from yoga to Pilates There are a ton of YouTube videos that you can watch. Nothing has to be, you don't have to pay for a gym membership or buy a bunch of weights. You can use cans of vegetables in your, pantry. And as you get better at it, you can, decide to buy weights or something like that. But you can also just use your body weight or resistance bands. There's lots of ways to increase strength training. And then just tying it back to what we were talking about earlier, and that is making sure that you combine your protein with your strength training, because your protein is what feeds your muscle and allows your muscle to be maintained over time. So that's super important. So I think, Lynn, you're going to cover these simple strategies that you can implement tomorrow.
Yes. So hopefully after listening to us for the past half hour, you're going to come out with some things that you can do tonight, tomorrow, that are going to make you healthier. So the first thing we talked about, eating a good breakfast. So whatever that meal is, when you wake up after a prolonged period of fasting, you want to switch out your sugar for protein. And that's, I think, probably one of the harder things to do, because anything grab and go in this country for breakfast is sugar-based. Your donuts, your bagels, your muffins, a lot of the cereals. So to be mindful of that and to be able to have easy to go protein-based breakfast, we always recommend eggs, yogurt without a lot of sugar in it, cottage cheese. But those are good ways to get protein into you on the go, because we all are busy, and you're not going to be able to make yourself a nice veggie omelet every morning. But again, really try to focus on a protein-based breakfast.
And I think just one thing I'd add is, or just to share an anecdote, when I was first starting out doing some weight loss medicine and obesity medicine in my gynecologic practice, the first thing I would tell my patients that I tried was switch out your breakfast. Let's try 3 eggs for breakfast. And let's just do that for a year. And we would do that for a year, and they'd come back 15 pounds lighter. Because breakfast sets the tone for the day. It also sets your body up to burn fat for the day. So it's super important. And breakfast doesn't have to be breakfast food. It could be leftover chicken from the night before if you're inclined to eat that. So kind of think outside of the box when you're thinking about protein for breakfast.
Right. And I was going to say, in many other countries, they actually do have leftover food for breakfast, as opposed to Americans, where we have this idea of packaged food. The second thing that you can do that's going to have a huge influence on your health is to get a minimum as an adult of 7 hours of sleep a night. For children, between 8 and 10 hours of sleep a night, depending on, and I'm talking about children school age and older. But your immediate effects of that is you're going to have better energy, better mood, better school performance, better sports performance. I find it really interesting right now that all the major sports leagues, such as the NBA, the NFL, Major League Baseball, have gotten really into hiring sleep coaches, setting their schedules to maximize sleep, because improving sleep tends to have a better effect in a shorter period than even illegal ways to improve sports performance like steroids. So I always say sleep is your secret weapon. So if you're going to pick, one thing to focus on, sleep. Increasing, like we said, just daily movement. Just get moving. It doesn't matter what you're doing, but if you do a little bit often throughout the day, as Dr. Kirson says, at the end of the day, it all adds up and it all counts. And then avoid sugar.
I think we drove that home, right?
I think so, hopefully.
Yeah. Okay.
So again, what happens when you eat better, sleep better, and move better? You're going to feel better. Again, better energy, better concentration, better sports performance, better immune system, which we all certainly have been thinking a lot about, right, during this past year with the pandemic. You're going to have a decreased risk of many, many future diseases. And we always say the side effect of all of this is that you'll be happier with your weight. So traditional weight programs kind of focus on you have to lose the weight in order to be healthy. Dr. Kirson and I say, if you focus on being healthier, you will be happier with your weight. And then if you want to learn more information or you want to come meet with either of us individually and learn more about our Ortho Health program, the information is on the IBJI website, but Ortho Health is a comprehensive, what we call metabolic health program involving myself and Dr. Kirsten. So again, we're trained by the American Board of Obesity Medicine, amazing dietitians, physical therapists, and behavioral coaches. And we also have connections with really amazing sleep doctors to really try to maximize your metabolic health in a way that's individualized to what you need.
We have a question. What is your opinion of intermittent fasting?
So intermittent fasting is a great tool. There's actually different forms of intermittent fasting. So there's time restricted feeding. There's what we call a 5-2, 5 days a week you're eating normally, and 2 days a week you're fasting completely like a water fast. There's also alternate day fasting, where you eat regularly on one day, and then the next day you cut your calories down to 500 calories. The intention of intermittent fasting is to challenge your body to access its own individual stores of energy in the fat cell. If you are doing it consistently, it can help significantly. There's also some information about it reducing inflammation over time and promoting what we call autophagy, which is regeneration of cells and repair of cells. But the most important thing about intermittent fasting is to make sure that when you are feeding, when you are actually eating, that you're still eating the right foods. Intermittent fasting will only take you so far if you're eating if you're eating poorly during your feeding window. So combining good nutrition, healthy nutrition with intermittent fasting can be a powerful tool to improve metabolic health.
And I'd like to add one thing to what Inbar said. So she mentioned time restricted feeding. I think that's probably the most common type of intermittent fasting people do, where they will only eat between certain windows. And what we have found is that when those windows are is actually important. So Inbar mentioned your biological clock that's set by light. So our body is programmed to do different things over a 24-hour cycle, dependent on how we sense light and dark. Each individual cell has their own 24-hour cycle based on nutrition and how they sense nutrition. So if they're out of sync, so if our biological clock is telling us at 10 o'clock at night to go to sleep, and we decide to make our intermittent fasting window between 6 and midnight, it's very confusing, because one part of your body is saying to do one thing, and then your cell is sensing nutrients. So most, I think, diets agree that eating earlier in the day is always better. And like what Inbar said, if you decide to make your fasting window, let's say early in the day between 10 a.m. and 5 p.m., I'm just throwing that out there. If you're filling that with a lot of sugar during that time, you're not going to get that far. You still have to eat healthy. So I think that's important to remember, that the timing counts and what you eat really counts.
Definitely. So the next question is, are there clinical tests to determine whether the body is in an inflamed state, or is it just symptomatic that you would know and feel it?
I'm going to say some, and I'll let Inbar also jump in here. So I think what's really interesting is that we don't tend to sense inflammation until we're really sick. And I think part of it's like what Inbar talked about, like the modern human has existed for thousands of years, and we are programmed for famine. Like, we are really programmed to sense when we don't have enough food, right? You get shaky, you get hungry. We don't sense when we have too much food, because we've been around for thousands and thousands of years, and maybe only in the past 100, if that, in this country, have we had too much food. And I think it's the same with inflammation. I think we are not programmed to sense this inflammatory cascade until we're really sick. So I'm going to let Inbar talk about, there are so many different tests, blood tests, and many different tests to test for inflammation. But our point of what we do in Ortho Health is to head it off at the pass. We don't want you to have so much inflammation that you feel sick. We want to do all sorts of things that hopefully are easy to do to prevent you from getting that much inflammation. And Inbar, I'll let you talk about the test.
Yeah, no, that was great, Lynn. I mean, I totally agree. I think there are ways to identify inflammation. Certainly some people do feel sick and come to see us, and we can certainly put our, our finger on the pulse of what's going on. But more importantly, it's identifying people who are at risk for those conditions in the future. So we can do blood tests that can tell us 10 to 15 years from now, are you going to have this chronic inflammation? Are you on that path? And how do we, again, kind of stop it in its tracks, reverse the process? And we can reverse the process using good nutrition, sleep habits, movement, all the things that Ortho Health is about. And that's really the key, is we're trying to improve not just your metabolic health, but your overall health and optimizing it. So when we check these blood tests, we get a lot of hints. And some of the blood tests that we do are a little bit more advanced than a routine blood test with your general physician. And that's just because we have that knowledge and we have the ability to do that, and we know how to act on it. So, it's really a valuable tool for us to identify people at risk for chronic inflammation, or people who are starting with inflammation, and that's going to lead to disease, and trying to head that off at the pass. So yeah, there's lots of ways to identify inflammation and to stop that from becoming worse.
Great. The next question is, one of the doctors mentioned that the fat cells become dysfunctional and release things that create inflammation. The question is, as you cut down on sugar, do the fat cells repair themselves and go back to working properly?
Yes, they do. That's exactly right. They do. They shrink back down, and then they can function in their normal capacity. So we call, when a fat cell has kind of grown out of its capacity and become abnormal, that's called adiposopathy. So the adipose tissue is the adipocyte, or the fat tissue is the adipocyte. And adiposopathy is an abnormal functioning of the fat cell. And as we allow that fat cell to shrink back down, it no longer has to behave abnormally. It can go back to functioning the way it's supposed to be functioning, and it will reduce the amount of inflammatory markers that it is secreting. So oftentimes when we check inflammatory markers or blood tests, we'll see a low-grade inflammation. Simple tests like a high-sensitivity CRP can give us an indication of where the person is in their inflammatory status. But it's that bigger picture that's so important, because just one individual blood marker does not define chronic inflammation in a person. Looking at the bigger picture, assessing the patient with regards to their medical conditions, other complaints or concerns that they have, other blood tests. So it's that inflammatory state in the context of everything else that's going on with the patient that matters.
That makes a lot of sense.
Yeah, just quickly add that when Inbar and I were in medical school, I won't say how long ago, we were taught that fat was just a storage tissue that didn't do anything. And we learned that it secretes over 300 different types of chemicals, and a lot of them are very, very inflammatory. So you hear a lot about this with COVID, something called a cytokine storm. And there are all these chemicals that really up your inflammation. And you hear about interleukin 6 and interleukin 1 as being some of the chemicals involved in the COVID cascade. Sick fat will secrete these same inflammatory compounds. So it's almost like once your fat tissue becomes sick, it just takes a life on of its own. But as Inbar said, there's so many things that you can do to reverse that.
And I think that's why also we're seeing such severe cases of COVID in people who have sick fat, right? You're compounding that inflammatory status. You're getting COVID, which is causing all that cytokine storm, in addition to the already existing chronic inflammation in a person's body, and that just overwhelms the system.
Yeah, that makes a lot of sense. Thanks. So we had actually a lot of questions, and I know that you had kind of touched on it a little bit with the previous question about fruit, and which fruits are okay, and how do you know if you're eating too much fruits, or are fruits and smoothies okay? Is it okay if you pair it with proteins? Are there general guidelines? I think you're talking about the fiber content, but other general guidelines to follow when consuming fruit.
Can I talk about? I'll let Inbar jump in, but I would love to talk about smoothies, because I feel like, especially with my teenage patients, they all love smoothies. So I always say it's always better to eat the piece of fruit than to drink it. And even in a smoothie, you're chopping up the fiber in that fruit. And again, we explained that having fiber in fruit is what delays the release of the natural occurring sugars in the fruit. I also like to say as a guideline for smoothies, if you have like a huge bowl that you're putting into your smoothie that you never could actually eat, then that's too much. So if you're putting in a pint of strawberries, a banana, concentrated orange juice that's made from, 12 oranges, if you put that in a bowl and tried to eat it, it would be bigger than your stomach. So I always say, like, you never want to add juice into a smoothie. Always really try, I always say it's like an emergency, a last resort, really try to eat the whole fruit if you can. And again, if you're gonna, it depends on, like I said, Dr. Kirson talked more about this, it depends on what's going on with your body and what your needs are. But as a rule, I like to say, if you have a choice, go for the fruit with the highest fiber. And again, you can look, they're all listed, there's so many great websites that list this, but it tends, like I said, berries would have a lot higher fiber than grapes, which don't have very much fiber, would be an example. Or like I said, pineapple that we get now that's been cultivated and bred to be really sweet is very different than pineapple you'd find in a forest of an unpopulated island. So you really want to look at the fiber content of the fruit, try to eat the whole fruit, and try to avoid drinking it if you can.
Yeah, I agree wholeheartedly. I think that too many times we overdo it on the fruit when we do a smoothie. So I give patients some fruit rules. They're very simple. One is always pair your fruit with a protein, because that will slow the absorption of the sugar. So simple things like having plain Greek yogurt with some strawberries. You've got the plain Greek yogurt that's going to pair with the strawberries. Again, you're looking at lower glycemic index fruits, which means lower sugar, higher fiber fruits. And so berries are going to be your go-to. Or having a piece of cheese with a pear, or having an apple with peanut butter. Those are ways to actually slow the absorption of that fruit sugar, because fruit sugar is fructose, which is a little different than glucose and table sugar, but it's still sugar and your body still recognizes it as sugar. So we want to pair those two together. The second rule is limit yourself to about 1 or 2 fruits a day as an adult, because you really don't need more than that. And oftentimes people are turning to fruit because they're looking for something sweet. And as Lynn mentioned earlier in our talk, we want to try to reduce those sweet receptors. We don't want to feed those sweet receptors. We want to reduce the need for sugar and sweetness in our diet. And the more fruit we eat, the more sugar cravings we're going to have. And then the third rule is really, Lynn has already touched on it, which is try to avoid those higher sugar fruits and really aim towards the berries and the citrus fruits, which have a lot of fiber in the pulp, and eat the whole fruit. And that will help you in terms of just eating the right fruits, getting the micronutrients, the vitamins that we want from fruit, but not overdoing it on the sugar and ruining our diet.
That makes a lot of sense. A lot of the questions are actually very carbohydrate focused. There's a lot of questions in terms of how many carbohydrates should we have, or should we limit? Are they good or bad? Is there a stance either way? Is there any sort of, what can you tell us about that?
So I think Lynn mentioned this early on in our talk, and that is that there are essential and non-essential nutrients. Essential meaning things that our body needs to get from our diet, and non-essential meaning our body doesn't need to get them from our diet, our body can make it on its own. And so you could go through life without eating a carbohydrate. And when we talk about carbohydrates, we're talking about bread, pasta, rice, potatoes, sugar, right? Those are the things we're talking about that you can go through life not having to eat. However, we all know that they're part of our diet, they're part of our life, they're part of our existence as humans on the planet right now, and they're hard to avoid. And so if you limit them, you want to understand how to limit them. You don't want to go too low if you have medical conditions that can be affected by going too low. But everyone has that carbohydrate tolerance, and identifying that is really goes back to our initial kind of focus on how do you identify that you are metabolically healthy. that I'm sleeping well, I have good energy, I'm able to maintain my weight, I'm not super hungry all day long and riding the sugar roller coaster. And if you're eating a certain amount of carbohydrates and all those things are actually happening for you, then you're in a good place. That's your carbohydrate tolerance. But if you're not in a good place and you are riding the sugar roller coaster and you are gaining weight or have gained weight and are sluggish and are not sleeping well and have fog brain and all these things, then the carbohydrates in your diet might be too high, but there might also be other things going on. So it's hard to answer the question of what is the right amount of carbohydrates because it is so individual. But to know that carbohydrates are not essential, but just foods that we like to eat, that's important. And then I always kind of advise people, if you're going to eat carbohydrates, eat them last in your meal. So eat your protein first, your vegetable next, and your carbohydrate last. By doing that, you probably would eat a little bit less of that carbohydrate than you normally would have. And you might even avoid it because you might be so satisfied because you're sending off signals to your brain by eating protein and vegetables. Your brain kind of feels satisfied. And we have satiety signals that actually stop us from eating. And so if we eat enough protein and vegetables, we often don't want that carbohydrate. But even if we do eat it, we eat a lot less of it. So I don't know, Lynn, if you wanted to add.
Yeah, the only thing I would add is I always say if you have a choice, switch from white to brown. Brown bread, brown rice, brown flour, brown pasta tends to have more fiber in it and less carbohydrates. It tends to be what we call less refined. So that's a way to add a little bit, have a little bit more protein, a little bit less carbohydrates. And then I go along with what Inbar says, and I say try to make if you can make half of your plate vegetables, and then use the other half of your plate to have at least, be half protein, half carbohydrates. That's another way to limit your carbohydrates. It's just to think of the composition of your plate. I think in restaurants, we get a huge plate of French fries and a little bit of protein, or a huge plate of rice and a little bit of vegetables. So I think if you can just think of making half your plate vegetables, and then it really would depend on what your carbohydrate needs are, as what Inbar said, depending on your metabolic health, but you're never going to go wrong eating more vegetables.
Yeah, and I think also the other thing to remember is that in the United States, anywhere from 75 to 85% of adults have what we call the start of or signs of metabolic syndrome, which is a level of carbohydrate intolerance. But that also means we have 15 to 25% of people who do fine eating carbohydrates, who eat carbohydrates galore, and it doesn't affect their body. So we do, I don't want anyone to take the message home that carbohydrates are absolutely 100% bad for everyone, because they're not. It's just really finding that sweet spot for you as an individual that's so important. And that's something that Lynn and I do all the time in treating our patients, is helping them find that sweet spot.
Sweet spot, no pun intended.
Exactly.
True.
Similar to kind of the carb focus, there's a lot of focus as well on can you overdo it with protein? Both with, there's a lot of questions about eggs, which I think you guys touched on, but also whey protein. And just, is there a way to kind of go beyond what you should be having, similar to kind of other areas like sugars and stuff like that?
I mean, again, it's so individually based. Yeah. But you can, you need to have a variety of nutrients. So if you're just eating protein and not eating vegetables, you're going to miss out on all the vitamins that we need and fiber that we need from vegetables. So there absolutely is a balance, and it's going to be different depending on what's going on inside of your body. So you could eat too much protein. And then one thing that Dr. Kirson and I do is we do evaluate your cholesterol, and to make sure that you don't have any hereditary cholesterol issues where certain types of protein might not be as good for you, such as saturated fats or the source of your protein. So it does matter, but it's very, very individually based.
Yeah, I think something to understand is that we talked about activating muscle and how muscle is really your metabolism. Once you activate your muscle is what drives your metabolism. The more muscle you have, the faster your metabolism. The more efficient your muscle, the better your metabolism. And what turns on that muscle, so we know through research done by Donald Lehman at University of Illinois in Champaign and through Dave Sabatini over at MIT, that there's a pathway in the muscle called the mTOR pathway. If we want to turn on that muscle, which is muscle synthesis, it's building muscle, then we have to have 30 grams of animal protein, which contains another little branch chain amino acid called leucine. It has to have a certain amount of leucine to turn on that muscle. So 30 grams of animal protein is kind of that important amount of protein to get at that breakfast meal to turn on the muscle for the day. But then there's that balance of when is too much, too much of a good thing is not great for you. And you can overdo it on protein, because if you eat an excess amount of protein, depending on your muscle mass, that protein above and beyond what your muscle can use is going to be converted in the glucose alanine cycle in our liver to sugar and then stored as fat. So you do have to be careful. Too much protein is not good for you. If you have kidney disease or you have other medical conditions, too much protein can affect that as well. So it is finding that balance. And you don't need as much protein as some people think. But you do need an adequate amount. So a portion of our population doesn't need enough protein, and some of our population needs too much protein. And that balance is important. But 30 grams at breakfast, and then somewhere between 20 and 30 grams for lunch and dinner each, is a good rule of thumb to wrap your head around. And each ounce of, I just make it simple, each ounce of chicken, meat, and fish and an ounce of cheese are all 7 grams of protein. So it's somewhere between 3 to 4 to 5 ounces with each meal of protein that's going to give you the requirement that you need. And with regards to whey protein and protein shakes, if you're using it as a supplement during workouts, after a workout, trying to get 15 to 20 grams of protein to stimulate muscle synthesis, it can be beneficial. But again, if that takes you over your limit of protein for the day and your body converts that to sugar, it's not doing you any good. So really you don't have to pump the protein too much. You just have to get the right amount.
Right. And I think you have to, like what you said, Inbar, about whey protein, you have to be careful what it comes with. Because again, if you look at the labels of a lot of these protein drinks, there's a lot of sugar hidden in those labels. So
yeah.
Awesome, that's very helpful. So we're getting close here. I know we've gone a little long, but I do have one last kind of groups of questions that are coming in about exercise. And some folks are asking, how do I exercise if I'm in pain? And so if you could speak to that and maybe solutions that, you guys have for that.
So I think that's a really common problem that we see at Ortho Health. And when I see patients to help them correct their metabolism, I actually don't ask them to move too much at the beginning, because your cells are exhausted. They can't access the energy that they have stored in order to get you to move. You also have this chronic inflammation if you're in pain. And again, we want to lower that inflammation, and food is the best medicine we have to lower that inflammation. Once we start to get that inflammation down, invariably people will come to me and say, okay, doc, I'm ready to move. Can I move now? Am I allowed to move? And I'm like, go for it. Let's move. But at Ortho Health, we incorporate our physical therapists, and that movement is safe. That's going to be effective movement to strengthen the muscles around those joints that are aching and to help support those joints so that you have less pain. And so the combination of improving your diet and learning how to move effectively to reduce your pain is a really powerful tool. And that's what Ortho Health really helps people to do.
Okay, great. Couldn't be better said.
Thank you.
Well, I want to thank you both so much, Dr. Inbar Kirson and Dr. Lynn Gettleman Chehab, for spending some time with us tonight and for giving us all this helpful information. For all the folks that are still on, the information for both Dr. Kirson and Dr. Gettleman Chehab has been on the screen. So I know we weren't able to get to all the questions tonight, but please, visit ibgi.com, find their profiles, reach out, get connected with the Ortho Health program. It's a really great resource to get folks on the right track for long-term health. So just before we go, I do want to mention that In May, our next webinar is going to be understanding physical and occupational therapy. And we're going to have physical therapist Julianne Rhodes and occupational therapist Zoe Goldhirsch that are going to be joining us to teach us a little bit more about understanding physical and occupational therapy. So with that, again, thank you so much to the doctors. Thank you everybody for joining us, and have a wonderful night.
Yeah. Thank you. Good night, everyone.